Assalamu alaikum. In this video we are going to discuss about ENT's Ospe, and this is mainly my third video on ENT's Ospe, and we will discuss nose instruments in this video. Actually, some of the nose instruments like lux forceps are discussed in my first video where I have told you about all the forceps and how you can differentiate in between all the forceps. Either they belong to ear, either they belong to nose or throat. So remaining nose instruments mainly will be covered in this video. Here in this video I'm going to change my pattern somewhat. In this video here I will show you first the pictures from Tille, and then we will see the pictures from some other sources as well, inshallah. Okay, so let's start with its first instrument. You can see that first instrument here is Lichtwitz Trochar and cannula. And how you can say that this is the Lichtwitz Trochar and cannula? Mainly it has a flat handle, somewhat flat handle, and it is this instrument is mainly made up of steel or metal. And inside it this is a long thin trochar is attached. Okay, so this is the trochar, and here is its handle. And why it is used, where it is used, its main purpose is that if we insert a cannula through the inferior meatus, like you know that this is our nose, and in its lateral wall here is superior meatus, middle meatus, and then comes the inferior meatus. We insert a cannula mainly through the inferior meatus, and by this device first we make a puncture. Okay, this instrument is mainly used in the antral lavage or proof puncture. Antral lavage means for washing the antrum. This instrument is mainly used. And why we use the inferior meatus to access the antrum? Because it is easily accessible and it is safe as well. On number 2, this is Tille's harpoon. Okay, remember that it is a handle. It is a handle to hold it, and then it has some at its tip somewhat diamond shaped or triangular shaped or pencil shaped, I may say that its tip is somewhat pencil shaped. Okay, and in the case of Tille's antral burr, as you can see it has also handle, but its tip has somewhat ball shape. Okay, like rounded or ball shape is present on its tip. So you can remember it as B for burr and B for ball. At its tip ball is present as compared to harpoon. P for it means in harpoon P is present, so you can remember it as it has somewhat P shaped tip as compared to. But please don't confuse it with Lampert's curator scoop. I'm again telling you, I have told these three difference in my ear instruments video as well. I'm again repeating here that this is Lampert's curator scoop, and as per scoop, so it has somewhat spoon shape at its tip like this. Okay, so what is the purpose of Tille's harpoon as it is written here? And it is more than enough for your OSPE. If you are studying these instruments for your OSPE, then it is more than enough. The Tille's harpoon is mainly used in the it is also used in the in for the creation of intranasal antrostomy. Okay, antrostomy means that in the antrum, if you want to create a hole or an opening, like this is the nose, and here is the, for example, if you want to create an opening in the maxillary sinus, you will go through the nose by this instrument, and then you will go into the antrum, and you will create an opening in the antrum. But this antral burr is mainly used to smoothen and enlarge the hole or opening that is created by this Tille's harpoon. I hope so this will be clear now. And next instrument here is Rose's sinus douching cannula, and on it has a tip, and on its end a ring shaped structure is present on its distal end, and this is also used for the irrigation of the maxillary sinus. Okay, which already has a nasoantral window. It means like during, if you are performing Caldwell Uke operation, intranasal antrostomy is done by the Tille's harpoon, and after that opening is enlarged by the Tille's antral burr, and then you use it Rose's sinus douching cannula for irrigating that maxillary sinus to clear the secretions from that sinus. Okay, lux forceps I'm not going to discuss here. It is discussed in first video. then comes the nasal snare. A nasal snare, you can see here that it has three rings present here, and at its end there is a wire present. But don't confuse it with Eve's tonsil snare. Eve's tonsil snare has similar three rings present here, and it has that Eve's tonsil snare also has a wire loop present at its tip, but that Eve's tonsil snare doesn't have a curve here. But in the nasal snare there is a curve as well. Krause's nasal snare. And what is its purpose? Why we use it? It is used for the removal of the nasal polyp. Actually, let's suppose that this is again your nasal cavity. This is one nostril, this is the other one, and here a polyp is present. Okay, a polyp is present, and what you do, you use this nasal snare, and you mainly use this loop. In this loop this polyp is engaged, and then you evulse it. Or you can say that uh, with the advent of endoscopic surgery, its use has been now declined. Okay, in the previous years or previously we used nasal snare to simply avulse this polyp, but now endoscopic surgeries like FES has been designed, so we its use has been declined now. Next comes the Clair Thomson's nasal speculum. It has long blades, or it also can have short blades as well, and you know that it is mainly used for anterior rhinoscopy. And for the purpose of posterior rhinoscopy you use a mirror somewhat like this, and it has a handle, but in its handle a curve or zigzag is present. And I will show you that how you can hold this Clair Thomson's nasal speculum. It is also called Thudiculum, and in the later pictures I will show you. Next comes the Killian's long-bladed nasal speculum. We have already discussed it. Tille's dressing forceps, Hartmann's dressing forceps are covered in very first video. I'm not going to discuss it here. Then comes the Wiley's dressing forceps. Here you can see simply you can see that it has it has two legs, and simply these legs then join, just like a cockroach. It just resembles like the cockroach legs, just a mnemonic. Okay, and it is used for packing the nasal cavity or ear canal. And then comes the Bellinger swivel knife. It has a tip, and then it has a blade at its end. And it is mainly used in SMR operations or mucus resection. Okay. Then comes the Killian's nasal gouge. Killian's nasal gouge has a it has a handle, and it has, or you can say that it has two handles or two ends. It has mainly not handles, it has two ends, one this and the other one is this, and these two ends are then joined by a curve, or a curve is present in its neck. Simply remember that one end, second end, and joined by a curve in its neck. And it is also used for the removal of septal spurs or bony crusts, and we can say that mainly it is used in SMR operation. In your exam you can simply write it is used in SMR operation. Freer's double-ended elevator has also been discussed. I have told you its difference, Freer's double-ended elevator's difference, and this McQueen's curate and cell seeker's difference in the previous video. Okay, in the previous video of ear instruments you can watch from there. And then comes the Walsham's forceps and Asch's septum forceps. Just remember it, that what are the difference between these two, Walsham's forceps and Asch's septum forceps. Both of these are mainly used for reducing fractures of the nasal bone, and mainly both of these are used in the closed reduction. What is the closed reduction of the nasal fractures? It means we do not give any incision in that procedure. Open reduction is that where we give the incision, and after that we reduce the fracture. But in the case of closed reduction we do not give any incision, and these two are mainly used in the case of closed reduction of nasal fractures. Okay, so I will show you that what are the difference between these two. Okay, so you can take screenshot of this picture. This is Asch's forceps, and this is Walsham's forceps. Here you can see that Asch's forceps has two limbs, and then it has somewhat curved blades, and then come the blades, and its blades are somewhat curved, not straight like in Walsham's forceps. Okay, number two difference is that, clearly see see it just carefully, that in the case of Walsham's forceps, when this instrument is closed, both these blades are approximated with each other or joined with each other. But when Asch's septum forceps is closed, then there is still a gap present in between these two blades. Okay, so this is the main difference between the Asch's and Walsham septum forceps. And this is the way how you can hold that Thudiculum or St. Clair Thomson's nasal speculum. You can see here that you have to insert your index finger in between these two in between these two projections, or in this U shape. You have to insert your index finger, and by your middle finger you have to hold its one prong, and by its your little ring finger you have to hold its other prong, and then you just apply pressure by this middle finger and ring finger to close both these two. Like here shown, when it is closed, you put it into the nostril of the patient, and after that you open it. You open these two in order to see different structures in the nose, like polyps, etc., or other abnormalities can also be seen, like here. Okay, it is opened. It is opened when it is inserted into the nose. Then this is nasal snare, as it has a curve in its neck. Okay, then comes the eaves tonsil snare, which doesn't have a curve, it is straight. Again, eaves tonsil snare. This is Tille's harpoon, which has somewhat pencil shaped, or you can say the triangular shaped tip. Here is the antral burr, ball shaped tip. Again, you can see here. Here you can again see Tille's harpoon, and Tille's antral burr. This is nasal snare, as a curve in its present in its neck. Just look at it carefully. Okay, so, and this is Benneger's survival knife, that it has a tip. Okay, it has a tip, a curve in its neck, then a blade is present. And don't confuse it with trochar and cannula, Lichtwitz Trochar and cannula, in which also has a handle, but that has a trochar inserted in it. Okay, so that was all for today. We will cover in the next video about larynx and trachea instruments, inshallah, and that will be last video of our ENT Ospe. Thank you so much.